Hello everyone, welcome back to ManpreetRN Talks. So it feels really good to say this after a long time. So if you are a nursing student or preparing for NCLEX, OSCE or any other exam like NORCET, so you are in the right place. So today we are restarting this journey with a very sensitive topic that is very important. It is substance use disorder. This is not just theory. These are real patients, real stories, and real nursing responsibilities. So on this channel, we will break down substance use disorder in a simple language and assessment and communication is so how we exactly talk to the patient and patient education without judgment. So just we are coming back after a break like me. So welcome home. So if you are new here, you are exactly where you need to be. So don't forget to like, share, and subscribe my channel with your nursing friends because together we grow, together we pass. So let's begin. So what is substance use disorder? So in a simple words, a person keeps using alcohol or drugs even when it is harming their body, mind, work, and their relationships, and they cannot able to stop it. So why the brain gets addicted? So it is the substances that increase the dopamine effect because the pleasure effect. So with repeated use of these substances, brain needs more substance that is called tolerance. Brain feels sick without these substance that is withdrawal. And brain craves substance for more than their family, food, or safety. So that's why relapse happens. Then the DSM-5 criteria for this order. So what is this? It is a diagnostic and statistical manual of mental disorder. So healthcare use this DSM to diagnose mental health and substance use disorder. So according to this, a person has SUD if two or more symptoms occur within 12 months. So what are these symptoms? For this, think of four big groups ISRP. So I stand for impaired control. It is means uses more than their plan, tried to stop but failed, stop cravings. For example, a student plans to smoke once a week but ends up with smoking daily and he is not able to stop. Then as for social impairment, poor work or school performance, relationship problems, stops hobbies. For example, a man loses his job because he comes drunk to work. R stand for risky use. So it uses substance in dangerous situations. He continues use despite knowing harm. For example, a patient with liver disease continues drinking alcohol. It can lead to liver cirrhosis. P stand for physical dependence. So tolerance means needs more, and without it, withdrawal, he feels sick without it. For example, earlier one drink causes effect, but now he needs four drinks for the same effect. The next is the severity. So number of symptoms, then how much it is severe. So if two or three symptoms are present, then it is mild. For moderate, it's 4 to 5 symptoms. For severe, more than 6. NCLEX. So NCLEX tip is to remind its severity means number of symptoms, not the amount that the patient have used. So next is types of substances. So first, that is very important, is alcohol use disorder. So what is alcohol intoxication? So word intoxic means intoxication is the short term that is physically and mental effects that happen right after using a substance like any drug or alcohol. So what are the signs and symptoms that include slurred speech, unsteady gait, poor judgment, and disinhibition. So for example, a man become very loud, aggressive, and cannot able to walk straight after the drinking. So next is alcohol withdrawal that is very life-threatening. So it occurs when a patient stop drinking alcohol. So it occurs between 6 to 72 hours after the stopping drinking. So what happens in this? So at starting 6 to 12 hours, patient have tremors, anxiety. So after that, in between 48 hours, patient have hallucination like auditory, visual, tactile. So within 24 to 48 hours, patient may have seizures, and after 48 to 72 hours, that is very crucial, patient have delirium tremor. So delirium tremor is a very life-threatening condition, so we have to treat immediately. So what is delirium tremors? In that patient have severe confusion, fever, hypertension, autonomic hyperactivity, tachycardia, tachypnea, diaphoresis, severe tremors, psychomotor agitations, hallucination, as we have discussed, and visual or auditory tactile hallucinations. Like tactile means bugs that crawling under the skin. Paranoia, paranoia is like someone is threatening to me. Nausea and vomiting. So, for example, we look at a case study. The patient name is Mr. John, age is 45 years, and gender is male. Chief complaints, tremors, sweating, anxiety, nausea, and history chronic alcohol use for 15 years. Drinks 8 to 10 units of alcohol daily. Last drink it was 24 hours ago. So, as a nurse for the nursing assessment, subjective data it can go I feel shaky and restless. I can't able to sleep. I feel like something bad will happen. And the objective data we have can see tremors in hands, diaphoresis, and blood pressure. It was 160 by 95 mm of Hg. Pulse, that is 112 beats per minute, that is tachycardia. And respiration rate is 24 beats per minute. Patient have nausea and vomiting, agitation and anxiety. So we can interpret as a this patient is showing early alcohol withdrawal symptoms that is started between 4 to 6 hours after the last drink. So, possible complications that the patient can have delirium tremors and seizure, the grand mal seizure may be possible, and the chronic alcohol complications such as gastritis, liver cirrhosis, Rinck's encephalopathy that is occur within the definition of vitamin B1 thiamine, and Korsakoff syndrome that is the memory loss we will discuss in depth, and the peripheral neuropathy and malnutrition and dehydration. And the possible nursing diagnosis for this patient is risk for injury related to seizure and altered mental status, imbalanced nutrition less than body requirement, risk for fluid volume deficit, anxiety related to alcohol withdrawal, and ineffective coping. So nursing management that is very important for the to clear NCLEX exam. So first priority is safety management. So why safety is priority? Because alcohol withdrawal can cause seizure, delirium tremors, cardiac instability, or even murder death. So as a nursing intervention, so place patient in a close observation like high dependence area, and the patient should be kept at the nursing station. 1:1 observation is required. For seizure precaution, pad side rails is available. Bed is in the lowest position. Oxygen and suction should be ready at a time. Remove harmful objects from the patient bedside, and fall risk precaution should be taken. As a rationale, because withdrawal can cause CNS hyperexstability that can lead to seizure and agitation. So, as an NCLEX point of view, always safety is first priority for a patient.